Hello everyone. Good evening everyone. So today we have speaker here with us is Miss Ambika Warrior ma'am. Talking about her, she is an RCI registered rehabilitation counselor who has completed her master's in clinical psychology and is also a founder of Ananda Center for Counseling in Delhi. She is a counseling psychologist and a psychotherapist of repute and is certified in therapies like transactional analysis, cognitive drill therapy, cognitive behavior therapy, acceptance commitment therapy, and mindfulness, to name a few. She is the project head of the postgraduate diploma in school counseling course, which is in collaboration with a UGC recognized university, wherein her responsibility is to curate course content for this 1 year diploma program. She is a trained therapist and has certifications in various courses like parenting expert and facilitator, relationship consultant, a couple therapist, a sexual well-being educator. These are few more to be named here. This is about her, and her topic of speaking is today roadmap to becoming a counselor or a therapist. I am handling it over to Miss Ambika Warrior with a very fine question that I had on my mind to be asked upon very first. Like why this topic you chose for today's session.
Okay. Thank you so much, Rakesh. And I would like to welcome everybody who's watching this live on YouTube. That was a very nice introduction that you have given. And Rakesh, a very valid question, a question of curiosity from your end. Why this topic? I remember our first conversation or our first chat message that took place where you asked, ma'am, can you be one of the speakers? Because we're doing this constant, Saturday to Saturday kind of, uh, you invite speakers and they talk uh, about anything in the field of psychology.
Yes.
And I asked you what are the topics that you have picked until now. You said, oh, ma'am, it's like way too many that we have done. I don't even know. Probably many aspects of psychology. And at that time, I had a few youngsters who are probably about to pass their post graduation or just pass their post graduation, who are into one job but not really happy with what they're doing, not because the job was not good, but because they felt something is not kind of matching up. They were missing that connectivity or the link that they required. And I have always strongly felt that we need to help youngsters who are coming out of college, because when they come out of college they're very raw, and it's easy to get either overexcited and take a wrong path in a hurry to get into job, or it is easy to get so flabbergasted by the world out there that they may lose their confidence. And that's how I came upon this topic, that why don't we talk to people who are really looking for help to go beyond their studies? When they think that, okay, I have completed my post graduation, now what do I do? And Rakesh, if we see, we have a roadmap in our mind, right? We go to
Yes.
school, we complete our school, we go do our undergraduation, and then after undergraduation we think of the specialization that we wish to do, and that's exactly what you're also thinking of now.
Yes, ma'am.
What do I study? We just had this beautiful conversation right now before we started our live session.
Yes, ma'am.
And once you do that specialization, we are all really looking forward to earning money. And I guess that is how all of us are. And even I was the same at your age. But the only difference is, since that was a few decades ago, we did not have a person to tell, oh, this is how you progress. And of course, nobody knew at that time, and the options were very, very minimal. Maybe, it was easier for us to just fall into the norm and the framework of the society. And now, since you all have a lot of options, maybe it's confusing as well. But whatever said and done, if we can help people look forward as to, okay, how would I like to take my steps? Do I want to take a big leap, or do I want to take those small steps so that I know my risks are calculated? I think that becomes quite easy. And then, of course, it is up to the student or the person to decide what he or she wants to do eventually. But of course, having some experience in this field, I thought, I should be ready to share that experience. Then at least we understand where could there be a pitfall and how can I come out of that pitfall. So this is what got me to this topic, roadmap to becoming a counselor or a therapist. So here I would like to clarify a couple of points, Rakesh. We are not having a career counseling or a career guidance kind of a workshop. I am talking about the steps the students in psychology can take once they think that they are going to get into a work profile. I'm not going to talk about how to become a clinical psychologist or a counseling psychologist or a forensic psychologist or a sports psychologist, because I'm sure there might be these questions coming up in the viewers' thoughts as well. How do I become a sports psychologist? So I'm considering that you have already taken that step, or you're already looking forward to taking that step. Once that is taken, once you are almost through with your post graduation or undergrad, if you want to work between undergraduation and post graduation, then what do you do? Because that is where we get into that job world, the world of work, as we call in career guidance and counseling arena. So this is how this came into my mind. I hope this makes sense to most of you people
Yes, ma'am.
and it helps you all.
Okay.
So, Rakesh, I would like to ask you a question, if I may.
Yes, ma'am, please.
So, what is it that you have in mind to do?
As in, like,
What would you like to become? What is your aspiration?
my aspiration, I want to become an IO psychologist, an industrial organizational psychologist.
Perfect. That really sounds so nice. And what are the steps that you have in mind?
Steps currently, like, I'll be pursuing my post graduation in
Hmm,
abroad and then looking for some internships over there itself. And
hmm,
if got a good chance to go ahead with the work perspective there for a year or a two.
hmm.
Like, this is like current 3 years that I have in my mind. Let's see after that how does it works out.
Perfect. This sounds so nice because you have taken a short term goal for now. And then you said, let's see how it goes. But you are clear that you would take up internship,
Yes, ma'am.
correct? And that's exactly what I would like to start with as well. So anybody who wants to get into work, internship is very, very important. And when I say internship, I would recommend everybody to take up an internship where you are almost grilled. Because as an intern, we would always get all the dirty things that nobody else in the company or the organization or in the institution would want to do. But that is your stepping stone to resilience. Because while in school, while in college, while in the university, to some extent, you are in school, you're super protected. In college, you're not so protected. In university, maybe you have that, suraksha kavach to some extent, maybe 5%, 10%. But in the world of work, you wouldn't have that. You are the one to fend for yourself. And that you will learn only when you go through the grind. I'm not saying that it is a ruthless world out there, but the expectations from you is going to be high. And you may have to work at a faster pace than you normally have personally. I'm saying may have to work. I'm not saying you have to work, but you may have to work. This is where internship will help. And when we come to yes, yes, do you
Uh,
have to have?
One question, like, what kind of internship will be helpful? Like,
Right. Yes. Very pertinent question. So, when we are talking about internships in the field of psychology, see, you all know all the theory. I'm sure you people are excellent at theory because you all are scoring great marks, which means you're good with theories. But internship is the place where you should see that theory coming into application. Irrespective of which year you are in, when you go for internship, you should be able to understand, oh, okay, I have learned theory A, I can see it being put into use here. So Rakesh, in case of psychology, there is a small I don't know whether I should call it as an issue, but due to lack of any other words, I would still say issue. While we're doing internship, unfortunately we may not be able to observe the whole process of counseling or therapy,
yes,
because the client is going to talk about his or her internal feelings and emotions, things that may have probably hurt him or her for a long time, which they themselves did not realize. In all the other fields, internship is where you put in effort, work for the company, and you are able to work with the manager or the team lead or the project lead, whoever is in place, and you work in tandem. But in psychology, unless you are in a hospital setting, and that too probably in a government hospital setting, you may not be able to observe the client all the time, which is where there could be a small issue. So, which means you may not be able to see that theory getting converted into application per se. But nonetheless, like I am a person uh, who has many interns coming to me. So when there is a group of interns, there is a lot of activities that are done real time. So when these activities are done, they need to be done using the theories that these students have learned. That's where the theory becomes practical for them. Because I understand in college there is not enough time for them to do a counseling. And in colleges, therapies are not taught. You understand therapies theoretically, but you don't learn therapies by doing them. So, which is why the internship provider should keep this in mind, that the internship, it may be, and the college requires 1 month of internship. Is that 1 month of internship enough? No, probably not. As you begin as an undergraduate, that 1 month of internship is enough, because otherwise it becomes a lot of knowledge overloading, which may again not be good, because you do not know much, you don't have the foundation, and you're seeing too much happening, you may not be able to imbibe it. But from third year of your undergrad onwards, it would be good for you to do internships whenever you get time. It could be short term internships, say 15 days. But then be very clear in your head as to why you're doing that internship. Unless we are not clear in our head, we will not be able to clarify our doubts from the mentor. So let's say, for example, you come to me to do internship. If you do not know why you're doing the internship, you would never have doubts. And if you are not clear, you would never be interested in what you're doing. So why are you going for that internship to that particular place? I know getting an internship probably is not easy because you all have to find for those places. It's like खुद ही को ढूंढना पड़ता है कि कहाँ से internship करें. तो कई बार वो आसान नहीं होता, which I understand. But when you go, please ensure you have that list ready with you as to what do you wish to gain from the internship. Maybe it is possible, maybe it is not possible. So how I go about with my students is I always ask them, what are your expectations from the internship? So obviously they have their own expectations. Now, based upon their knowledge and based upon the curriculum that they have gone through until then, I ensure I clarify their expectations so that they do not have their expectations way too high. Because a student of undergraduation probably would never be able to understand if I talk about therapies, correct? And then there is a lot of role play. So ensure you are able to see these role plays. You become a part of role play. Because see, there is not a single human being who may not have something to talk about, which is nagging them. That becomes the issue, and you become the client, and the other student becomes the counselor. And there begins your journey into counseling. So it is very important that you open up during the internship. It is very important that you understand, how to observe, and that will come only when you work through it. So we all know unconditional positive regard. We all know empathizing with the client. We all know becoming how you are supposed to be compassionate. Fair enough, but until you do, how do you know whether you are able to be that person, or do you have to get into a more, intense kind of an internship? So, this is how you need to look at internship. And where while you're doing internship, ensure you make your own notes. Internship should not be taken lightly. Like I said, look at it as the time when you're being grilled. So the more you're being grilled, the better it is for you, because you become ready to take up any kind of a situation when you go out into that world of job. So, and the more you're grilled, the more doubts you have, and you become more clear into what you wish to get into. So let's say there is a student who comes to me who has completed post graduation, who comes to me and says, "Oh, I'm a person who would want to work with, let's say, adolescents." So when this person would start interacting with other adolescents or similar age group students, they understand how easy or difficult it is to get into the world of that client. Maybe from there, their entire attitude would change. So, I am a person, personally, I don't take cases of abuse. So, I don't work with children. I work with clients who are 12 years and above, and it goes up to, I think, my eldest client is 70 years old. So, that is the age group I work with. So if the surety has to come, okay, I can work with a particular age group and I'm not ready to work with a particular age group. If slowly that clarity, I'm not even talking about surety, if that clarity has to come, I need to constantly have that conversation. I need to try my counseling skills. Correct? So which is why now do you see the importance of internship?
Yes, ma'am.
So once you have that internship in place, and when you continue with your academic curriculum as well in the college or in the university, you start understanding where your interest is. And then you start honing your skills accordingly. So this is, according to me, the first step. Internship during your studies. So once your studies are completed, I would say that people should take training under the guidance of an experienced counselor or therapist or psychologist, depending upon what you wish to do. So, do at least a 3 month training, a 2 month to 3 month training, where you know exactly how the entire counseling session goes. The
So,
45 to 50 minutes of session, the entire flow should be so easy for you that even, in the middle of the night, if somebody would ask you, you should be able to say. So when you put in that 3 months to get trained, that's when you are ready to go out into the world. Once you do this training, then do sessions under supervision. Why I'm saying this is, I get queries from students saying, ma'am, I'm supposed to do supervised sessions, so would you provide that? And I ask them, what is it that you know to do in counseling? Because only when you know about something can I supervise you, right? So when I'm supervising, I'm just observing you and your methodologies. How are you taking the client from the time the client walks into your chamber for the next 60 minutes till you say, thank you very much, see you soon? So, how will you sustain those 60 minutes is what I'm supposed to observe, supervise. For that, you need to know that entire process. So, if you do not know that entire process, how can I supervise you? So, supervision would be the third step, according to me. So, there are people who ask me, ma'am, I want to get into a job because I want to earn. I understand your sentiments. But you can get into a job only when you know something. I'm not saying you need to know everything, you need to know something. So, that's something, these three steps are really, really important. And what happens is, Rakesh, see, in medical colleges, they have connection to do the house surgency. Correct. In management colleges, there are companies who would come and take you. So you do the internship and then you're hired in that company based upon your marks. In law colleges, something very similar would happen. But in psychology, it is not yet there. So, which is why it is important for you all as students to keep your eyes and ears open. Do not do internship, do not do supervised sessions just for sake of doing and getting that certificate. I understand that certificate is important for you to get your credits, but remember that is not the end goal. It is very, very important that you take your internships, you take your training periods very seriously, because you are going to touch upon lives of multiple other people. If you take your jobs easily and very lightly, you're going to disturb other people's health. You need to own up that responsibility. And if you are aware of how a counseling session goes, you're going to enjoy your sessions. So, this is all about counseling that I spoke. Now, the common question that people ask is, should I learn therapies? And this question, I think, comes from a space where people think, once I'm done with my post graduation, I am coming out as a therapist, I'm coming out as a counselor. No, you really need to invest in learning therapies. And be rest assured that you would not regret investing in therapies. It is important that you look at them as investments rather than expenses. Because if you spend 5,000 rupees on learning a technique or learning a particular stream of psychology to use with clients, you're going to recover it after you counsel probably 10 or 15 clients based upon how much you're going to charge in the beginning. So look at what therapy you think you're going to like to start with. Learn one therapy, start using it, then you understand, oh, okay, how do I polish it? How do I polish my skill even further? What else do I need to enhance myself as a therapist and a counselor? Now, there are a lot of therapies that are available. There are a lot of small, short courses that are available. So keep yourself upgraded. Read a lot of books. understand how therapies work. And when you are looking at YouTube, I know that many of us look at YouTube and try to learn. Look at YouTube that are authentic. Look at YouTube where it is psychologists who are conducting these therapies. That too trained and experienced psychologist. And one thing I would like to warn, I really want to use the word warn, is looking at YouTube, you will not be able to learn therapies. You will have to do it yourself. And when you conduct therapies, do it under supervision for sure. Because otherwise, you wouldn't know where you're going wrong. And if you get stuck, again, more than you, it is the client who's going to have a difficult time. So, supervision becomes even more important. So, I hope I'm kind of getting clear for you people out there, and you are able to see what you would like to do as you move ahead with psychology as a stream, or if you've completed your post graduation, how you would like to look at the world ahead.
Yes.
Great. So this is how I would like to put, the roadmap to becoming a counselor or a therapist as. So Rakesh, now when you look back, this previous question I asked, what is it that you have in your mind? Do you have more clarity for yourself?
Yes, ma'am. It's more clear and more insight that how I want to move ahead.
Because now it gives you an understanding as to what are the questions you can ask the person who would provide, or the company that would provide you with internship, right?
Yes, ma'am.
Or training. Because now you know, okay, in training, these are the aspects I want for myself. Because see, each of you may need a different, you may have a different requirement. We all may, it is not one size fits all.
Yes, ma'am.
Right? I may just want to be a counselor and not a therapist, and that is fine. So, my requirement from you as a person providing training would be different from my friend who wants to become a therapist.
Yes, completely.
So, yeah, sorry, you were about to ask me something.
Talking about this internships only, ma'am. How do we practice for role plays? Like how the role plays are important.
So, role plays are where one of us become the client and the other person becomes the counselor. And we try to take a real life situation. So if I'm the client and you are the counselor, I take a very small issue that I may be facing. Let's say, I'm not able to wake up in the morning at 6 a.m. and that's what I wish for myself. So are you supposed to only work with me for that 6 a.m., or does it require you to do many steps before coming to 6 a.m. conversation with me? So, since it is being watched by students of psychology, or that's what I'm guessing, there is something we all talk about, and which is rapport establishment. It sounds so easy, but are you able to establish rapport with the client? Because if that is not established, the session would not go ahead. For example, there are times when people say, oh, this is one of the sweetest doctor that I have ever met. And I would recommend you to go to that doctor if at all you have a stomach ache, for example. And when you go to that doctor, you have a completely different experience. You come back and say, I don't even know how Ambika could say that this doctor is the sweetest person. He's the rudest person I have ever seen on this planet. Why did that happen? Because rapport could not be established. So see how important that establishing of rapport is. So right from there, and your session begins the moment that client calls you up on phone saying, "Oh, I want to take a session." So from there onwards, you begin. So this is how we conduct role plays. So it is. I would tell, okay, this is the situation I'm going to role play. Now I am the client and you are the counselor. And then normally what I do is we take three people. One is a client, the other is a counselor, and the third person is the observer. So now the observer says, okay, these are the areas that, there should be improvement, and these are the areas that really went well. And then the person who was observing now becomes the counselor, you become the client, and the person who was the client becomes the observer. So this way, all three of you all know how to observe and how to start with the counseling session. So this takes at least 5 to 10 sessions for you to have that clarity, just to establish rapport. So we go stepwise. So you have establishing a rapport, you have to take case history, which doesn't sound like an interview. So there are multiple steps, because when we say counseling, it sounds so simple. But when you really sit in that chair of counselor, that's when we realize, oh, it was not as simple because I'm not trained in it. Once you're trained, it becomes easy. And then you gain confidence. That's how it works.
Okay.
Yeah. So, interestingly, last week I had seen a message in one of the groups that I am also a part of, where this person said, I have completed my course in a particular uh, part of psychology, and now I'm not sure what to do. So if somebody could help me, please send me a DM. So I messaged this person asking, what is it that you wish to know, how can I help you, in whichever way I can help you, please let me know, I shall be happy to do so. So this person said, I have completed my masters, and people have been telling me to undertake supervised counseling. The same thing I told you a few minutes ago. So, ma'am, I'm not too sure if I should take supervised counseling or if I should take classes in therapies, if I should learn therapies or if I should go for internship. And finances is a big issue for me. So then my suggestion to her was, what is it that you have learned in your internship? Because to pass your masters, you have to do your internship. I said, rework on your internship and start from there. Start going through your notes of internship, because I understand that in psychology, internships, you don't get paid stipend. You have to pay to get that internship. And this is, I understand that it is a little bit of a problem for all of us. Even I had to pay when I did my internship, and I too had this question mark, dangling in front of me. Why am I supposed to pay? Shouldn't I be getting the stipend instead? Because everybody else would get stipend, and why not me? The reason here is, as a psychology student, I'm not able to contribute when I'm doing in my internship. My internship is still in the study mode. So I would like for all of you all to look at this internship as the practical aspect of your college life for which you are paying. If in college you had to do practicals, you would have paid for that, right? So it is something very similar. It is the practical aspect that you're paying for. And this reason is because the counselor or the therapist or the psychologist sitting in the center is stopping her or his sessions and teaching you. So it's an undivided attention given to you. I have had students coming to me saying, ma'am, in my last internship, I was supposed to file papers. That's what I did in my internship. So that internship did not help that student at all. It is sad that they had to do it, but that's not what internship is. So this is why they ask for payment. So I would suggest that you all, and again, because you are paying for the internship, ensure you make the best out of the internship, that 1 month internship that you are going to go through. Is there any other question that you have, Rakesh, pertaining to internship?
Yes, ma'am. Would 1 month be sufficient, or there should be at least more of months to be invested in an internship after
No.
master?
Yeah, so after masters, you must invest at least 3 months, because that is when you know, how do I say, not everything, at least something. And you have chosen a particular speciality, be it clinical, be it counseling, be it forensic, whatever it is, and now you have narrowed down your requirement. So you are less confused. So please go through at least minimum 3 months, where the person can say, okay, Rakesh, today you handle this client and I'll supervise you. The mentor should feel that confidence in you, have that confidence in you, saying, okay, if Rakesh takes case history, I know I don't have to recheck. Or if Rakesh says, okay, this could be the underlying issue with the client, I'm confident about it. And that will come only with regular practice. So 3 months minimum, you should take internship once you complete your masters. So I would like to call it as training period rather than internship. So go for that training period. Have your doubts clarified. Ask more questions. Say, I would like to do more role plays. So that's how it would work. So me, I'm coming up with this 3 month training modules very soon, most probably from June onwards, for students of counseling psychology and clinical psychology. And one thing that I would like to tell students is, because they always ask this question to me, they always say, ma'am, why can't we observe the clients? The reason is, we ethically, only if the client allows can we allow you to observe the client. Like I said, it is their internal feelings that they're going to talk about. They're feeling most vulnerable while they are in the session. So many people would not like a third person, even if it is the intern sitting there. And even with recordings, it is only with client's consent that the recording can be shown. So I felt very bad when I could not observe some of the cases that I was, discussing with my teacher during my internship. So I know how you all would be feeling too. Unless we see how would we learn, but slowly you would pick up with role plays and peer counseling. So peer counseling is another important aspect. Peer counseling is again where we counsel each other on a real problem. It is not a hypothetical problem, it is a real problem. That is peer counseling. So, this is about internship, Rakesh. What would your next question be?
Once we are done with internships, what would be the next step that one should take?
The next step that one should take is, after the internship or the training period, start doing sessions. Do at least 5 to 10 sessions under supervision, and then you gain confidence. So I'm expecting that by this time you are also thinking of learning some basic therapies, which will help you understand the emotion and the conflict of the client sitting in front of you. Because that is where you will be able to, that is when you will be able to empathize with the client. That is when you will be able to understand, oh, from where is this client coming? Because the client may say many things superficially. Externally it may look like that, but internally it may be something else. So some basic simple therapies, understanding them in a practical way, would be very important. So it is important to look at therapies, start learning it, and it is never too early for you to start learning therapies. Recently, I had conducted an offline workshop on tools and techniques from positive psychology. So I have had students attending that. I have done my certification in transactional analysis. There were quite a few college students in that course. Because when we learn these therapies, first we are able to apply it on ourselves, and then we know how effective it is, and then we are automatically able to use it for the other person. That's why it becomes important to learn small therapies.
Ma'am, could you name a few basic therapies that one should opt?
So I would very, very strongly recommend for students to learn at least the basic of cognitive behavior therapy, CBT. Now, DBT, that is dialectical behavior therapy, is coming a big way, and it can be used in most of the cases of clients. And if somebody is very interested in helping helping clients who are into addiction, motivational interviewing is another therapy that they can learn. At least learn the basics, understand what they are, and then decide to go for the advanced one. Mindfulness is another beautiful technique that you can use with all age groups. So I use mindfulness in most of my sessions. And I told you I have an elderly client, right? 70 years old. So she has lost, I think, 2 kgs in 2 weeks just by using mindfulness techniques. So this is how powerful techniques can be when we start using them the right way. Positive psychology, techniques from positive psychology is another thing. If you are a person who wants to help people with phobia and anxiety, severe anxiety issues, cognitive drill therapy, CDT, by our own Dr. Rakesh Jain sir. That's one of the best therapies to learn. And it's very easy to learn as well. So these are the therapies that I would recommend. And if you are a person who is interested in conducting workshops, then maybe career guidance and counseling, parenting expert workshop, there are multiple.
Thank you, ma'am. Also, ma'am, like once we are done with the therapies and done with the supervised sessions and this like role plays and gaining the confidence, how can we, like move towards our marketing strategies and making our brands, making our own brand?
Very, very important question. Very valid question. And I would say something that I personally lack in, which is why I would advise all the youngsters to take care of it right at, from the beginning. And I'm sure you people are really good with it. You all are very media savvy, social media savvy. Use social media the right way to talk about yourself, to talk about your expertise, to talk about your strong points. You may not have to make an emotional drama out of it, but use social media. Say you are there, you are capable of doing XYZ, and this is your area of strength. So, and do start writing small articles, relevant articles, articles that are close to your heart. And please ensure that they are very valid. It is not to play with the emotions of people, but they are valid. And if we are talking about psychology and related aspects, talk about the researches that have been conducted in the area that you are talking about. So if you are a person who finds, say, for example, mindfulness helpful, talk about it. Say how it is helpful. How have you used it, even though it was supervised counseling sessions that you did? Nonetheless, you did it and you are seeing that change. Talk about it. Say this can be used. Encourage people to ask you more questions about it. So that is the way. LinkedIn is a great platform. Instagram is another platform. Facebook, of course, is there. But I guess, each of these platforms would have their own way of connecting with people. So use the right terminologies, use the right language, be formal enough, use the right kind of creatives to create that impact. Be open to questions, be open to constructive criticism as well, because there would be constructive criticism, and constructive criticism would teach us a lot. So be open to that as well. So that's how you can show yourself out there. I see a lot of students active on LinkedIn nowadays, and I'm very impressed to see that. I see people talking very specifically about, their area of interest. So I see this person talking only about research, only about stats in psychology, and using very simple terminologies explaining them. I'm seeing college students taking up one part of what they have learned and putting it on LinkedIn in the right way, which is really impressive. So, if these things can go out into the world, and once you have done your supervised sessions, I'm sure you will have a lot of insights to share with the next, academic session who would come out and pass out as psychologists. So, use social media, use podcasts. Yeah, I forgot about podcasts. That is another area that is helpful. So keep them short, crisp, so that people listen to it. Ensure you generate curiosity in people. So whenever there is curiosity, people approach, people would want to know more. Create that curiosity. So that is how you can proceed with showcasing your skills.
Okay. Thank you, ma'am. That's from my end. Anything that you would like to add on?
So yes, something I would like to add on is, Rakesh, that once you pass out, or once you think that you're ready to get on to your career as a psychologist, do not shy away from asking questions, because how much ever we learn, we still do not know it all. You may find it a little awkward, but that's okay. You may find your question to be a little silly, that's again okay. Ask questions, reach up to somebody who would probably have that answer for you. Maybe reach up to me, maybe I can give you that answer. So having that mindset of curiosity will help you learn more. That's how we keep enhancing ourselves. And psychology, I think it keeps changing, otherwise we would have never had so many theories and therapies, right? It keeps changing, which means we need to constantly keep upgrading ourselves. So every time you upgrade, there is a doubt. Every time you upgrade, there is more clarity. So both would happen, and it may never be a linear path. Linear means one straight path. It would be going like that. Paths may crisscross. Be ready. Be open. The more open you are to hear, listen, see, you would learn more. The more you learn, the more benefits this society will get out of you. At the end of the day, we are all here serving each other. So the more we are able to provide, the more we are serving the society. So this is what I would like to tell, and I would wish each one of you watching this streaming right now the very best. Understand what is it that you want in life. Be flexible with your understanding, so that you know when to change. When it is time to change, you take that step to change. And be open to receiving, be open to discussing, be open to spreading your learning. Never be insecure, because we are all interdependent. We cannot live independently. We are interdependent. Be ready to share your knowledge. The more you share, the more you know. Do not be worrying, oh, if I shared about this therapy to somebody else, my clients may go to that person. No, your clients will come to you, because you mean a lot to your clients. I will want to give a small example. 4 5 days ago, I had counseled a class 12 student. She was going through a lot of anxiety because she's giving her uh, JEE entrance exams. And the first day she felt nice, she got better. And after 2 days, her mother said, ma'am, can you take another session for my child? Unfortunately, I was unwell. I was not even in a shape to talk. And today, the mother's message, just before our session started, came saying, ma'am, if you're better, can we have a session tomorrow? Because my daughter has her exam on Monday. And she personally feels that if she talks to you, she would be able to give the exam better. We are already missing you. And this was just a 45 to 50-minute session I have had with this child. So if she has that confidence that talking to a person would calm her down to give the exam, why would your client go somewhere else? If you're doing your job well, people who need you will come to you. Be open to sharing, be open to listening, and you will do great in your work. So, if you are into clinical psychology, ensure you take the right kind of internships, you take the right kind of trainings, and you take right kind of supervised sessions. If you're into counseling psychology, again the same. Go to the right people. You may make mistakes, but then you learn from your mistakes and go forward from there. So, I would wish each of you the very best. I'm sure you all would shine in your respective areas. Take care, and you can probably reach out to us if you have more doubts, if you want to have a conversation about whatever we have discussed here today. More than happy to help each of you. Wishing you the very best once again. And Rakesh, it was great having a chat here. And I wish you also the very best
Thank you so much.
in your future, and take conscious decisions and conscious steps.
Okay. Thank you so much, everyone. And thank you so much, ma'am, for agreeing and getting to this platform and speaking over this insightful topic. I am sure that viewers, this must be an helpful topic for today. I, Rakesh Jagani, Counseling Executive at Career Nasha, signing off. Thank you.